Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric. This week, we are in Kumasi, Ghana. We are here to discuss options with the teaching hospital, and spearheading that is Emmanuel Acheampong, who is on our Board of Regents, and he's a master's student. Welcome back to the program.
Thank you, sir.
And with us is John Clark. John, welcome back to the program.
Thank you. Glad to be here.
So, Emmanuel, why are we here?
Well, I think that this conversation started about 3 years ago when we were looking forward to have Quorum set up a BLS ACLS center at Komfo Anokye Teaching Hospital. But moving on, we think that there's more to it than just a BLS ACLS center. I think that we're looking at a more productive partnership where we are able to send students from Quorum to have their clinical placement at Komfo Anokye Teaching Hospital. I think that's the reason why we are here this time around, to explore other opportunities.
So yesterday you showed us the 1,500-bed hospital.
Yeah, approximately 1,500-bed hospital.
And CAF is a hospital. What's the name of the teaching hospital?
So the name of the teaching hospital is Komfo Anokye Teaching Hospital. Shortened as KATH, CAF.
CAF. And it is the only teaching hospital, tertiary teaching hospital in all of middle and northern Ghana.
So until recently, it used to be. There are newer ones. What I usually would say nomenclature, because in terms of function, sometimes they also have to bring to us, because initially there were only two teaching hospitals in Ghana, Aebhric Teaching Hospital and then Komfo Anokye Teaching Hospital. With time, there have been other teaching hospitals younger than Komfo Anokye Teaching Hospital, but then they also lack certain expertise, so they still bring it to Komfo Anokye Hospital. So yes, we sit in a position where when we were just, we serve currently, we have 16 regions and we serve approximately 12 of those regions. So within the northern sector of Ghana, Komfo Anokye is the center.
So 12 of 16 provinces, counties,
Yes.
districts within this country of Ghana, and you guys are responsible for all of them.
So 12 out of the 16.
Wow. And tell us about the hospital.
Hospital is almost 70 years. Next year, hopefully, we might have a celebration if all things are put together well. But then it's called a Center of Excellence. We have various departments starting from emergency medicine, maxillofacial surgery, all the diverse areas that you can think of in the teaching hospital. Trauma orthopedics, plastics, internal medicine. So we take care of a wide range of patients, both adults and pediatrics and neonates.
And you work...
And then, of course, we run residency programs as a teaching hospital. So we have an MOU with the university in town. So all the medical students, all nursing students, biomedical scientists, they all come to this teaching hospital for their training.
So if you want to become a board-certified emergency doctor, you come here.
Well, you can be board-certified emergency physician if you come to Komfo Anokye for your residency program.
Yeah, brilliant. So you are one of the main nurses in the A&E department?
Well, would I want to say that? But at least I've done close to 15, 16 years at the department. So I've seen the inception of it till now. At the time I started working here, there were no specialist emergency medicine physicians.
Wow. Now
there are senior specialists. Almost some of them are consultants. So yes, I would say I am somehow also in the lead, yes, but then of course in terms of hierarchy, I have seniors.
All right. So John Clark, this is your first time in Ghana. What's your experience so far?
It's been really spectacular. It's amazing. And Emmanuel and I had this discussion the other day when we toured the hospital, that it really doesn't matter where you are. The problems that we encounter are so similar. They just have a different face and a different name. But the way that when we toured the emergency department, when we toured the rest of the hospital, the layout and the way that things go and the patient flow, it's identical to anything else that we would encounter in the UK or in the US or in Malta. It's an amazing system to see what they've put together and just the volume of patients that move through it. It's remarkable.
So we're really impressed with the A&E department, the emergency department. Tell us about that.
Well, so the emergency department is approximately 15, 16 years since it started. And this whole thing also came about just as the National Ambulance setup came about, the stadium disaster, So over the years, we've had this medical education partnership initiative, MEPI, where we had grants coming through. So we had what we call the Ghana Emergency Medicine Collaboration with the University of Michigan. So that the whole setup was to train emergency physicians, emergency nurses, medical students, and then to also teach research over the years. And so we started with 7 residents, and now we've had multiple residents around the country. This year alone, we admitted in Kumasi. In fact, the total number was about 52 or so, but we took about 22 or so here in Kumasi. The rest are shared between University of Ghana Medical Center and then Komfo Teaching Hospital. Yeah. So relatively, it's one of the newer programs in Ghana, but we've been here for close to 16 years.
How many beds do you have in the emergency department?
I think we have more than we are supposed to have ideally, because I think currently we should have roughly, I may have to make reference to that one, but then we have more than 100. Yeah.
And you also have a tiered system, don't you? So tell us about how someone comes into the A&E department and how do they get sent to the right place?
Right. So we run this sort of a triage system. Now, for anybody who presents at the emergency, we'll go through triage. We look at your triage early warning scores, and then we have discriminators. Now, you may have a normal vital signs. At the moment you say chest pain, you have chest pain. That is a discriminator that will send you to orange, which is a higher color, where you can have access to an EKG, be evaluated for any ACS-related condition. So myocardial infarction, angina, those ones are going to be evaluated. So basically what we do is that for everyone who comes in there, we do your vital signs, we look at how you enter the emergency, and then even if you have a normal vital signs, we look at the discriminator list. And that one will lead us to where we should send you to. So if you come in with a normal vital signs, active bleed, you'll be sent to orange. A normal vital signs, control bleeding, you'll be sent to yellow. You come with an open fracture will go to orange. Closed fracture will go to yellow if you have normal vital signs. Sometimes just the vital signs alone will push you to a higher color. So if you come in airway obstruction, you go to red. If you come in hypoglycemia, you go to red, because that's resuscitation. So this is how the system is run.
John, what was your experience going through? You've gone through hundreds and hundreds and hundreds of emergency departments in your few years of being a medical professional. What was your experience?
I will say this was the first place that I've really noticed that it's described by time sensitivity. It was really interesting. You look at a standard triage model, and whether you're fast tracking the patient into a clinic setting or they're coming into a more acute setting on the resuscitation side. But the discussion that Emmanuel and I had was about if you present to triage and you go to red, you see a physician immediately.
Yes.
If you go to yellow, you see a physician within 10 minutes.
Within 60 minutes.
Within 60 minutes.
Yes.
And then if you go...
Orange is 10 minutes.
Orange is 10 minutes. So I really, really like the idea that there's that kind of QA threshold that you're going to see a physician within a certain amount of time. That was the first time I'd seen anything like that. I really thought it was brilliant.
Is that unique to Kumasi, or is that a Ghana-wide system?
There's a policy to say that all healthcare institutions in Ghana should actually adapt the triage system. So certainly you're going to find this within some of the bigger facilities. It is trickling down to some of the smaller facilities where a patient can be sorted out and can be seen within the time specified. Yeah, so it's something that is gaining momentum, really.
And how many external medical providers do you have coming through your emergency department, coming in to get work experience?
That's uncountable. Yeah. Over the years, we've had multiples. So first year residents, second year residents, attendants, senior attendants. we've had medical students, we have nursing students all coming through, either coming to do research or we have engineering students coming through to look at the equipment we have that will help them with their design of certain equipment that we don't have, low-cost equipment. So yes, we've had countless number of people, and that some will come on missions. We have cardiologists coming on missions. We have Operation Smart coming through. So yes, it will be difficult to put numbers to, but over the years, we've had countless number of experts coming through to the hospital and through the emergency.
And how many of those, in our discussions, you've mentioned some of the University of Michigan, but how many you have students external to Ghana that also travel through there, right?
Yeah, so for instance, I had the opportunity of having my 6 weeks immersion training at the University of Michigan, between University of Michigan and Hurley. In recent time, we've had some of our residents going to some of the universities, hospitals in the US. We have 2 residents final years who were in the US recently. We've recently had 2 of the senior residents in the UK as part of observership. So yes, we have them going in to also look at that. And we're looking for more opportunities to have that exchange program where our residents can go and see how things are done in a more advanced emergency settings. And then we are glad to have those of them come see how we're able to survive patients without all the sophisticated equipment.
So building on that, we are here to see the option for setting up placements. So John, how do you see that? Now that you've seen the location, you've talked to the head of the medical department, and you've talked to the head of the A&E department, how's this going to work? Why are we here, and how is this going to help the college?
Well, in our bachelor's program, the traditional setting is to go to KCMC in Tanzania. We have a long established record there, and our students that are spending 5 weeks, they have it's a very kind of structured approach. I think what we've seen here in Ghana and just the enthusiasm of, the medical director, and certainly with Emmanuel's help, is that this is a much more sophisticated clinical experience. And I wouldn't be really comfortable putting a brand new student in here. I think this is a much more advanced opportunity for master's students, for second-year bachelor students, and maybe even some research opportunities for our doctoral students. Because the system that they have in place it's fast-moving and it's complex, and just the sheer volume alone, I think, gives an excellent opportunity for students that will come here. And so it will give us an opportunity to have a second relationship with a clinical site in Africa, which allows us access not only to the patient volume and the experiences that they'll get there, but to things that you would expect to see in Africa, even though they've done a fantastic job of nearly eradicating malaria. So you see some of the tropical diseases, things that you wouldn't have the opportunity to see in a European clinical setting.
So we're here to have a collaboration, and as a nonprofit, we're never going to come at this one-sided. So, Emmanuel, how is this collaboration going to benefit CATH and your hospital?
Well, I think in our discussions yesterday, we spoke about a lot of things. Getting access to the Aebhric platform to run BLS, ACLS, PALS. It's a fantastic idea. There's a demand now for those things. There's a requirement for you to have these certifications. And so I think that in as much as we are bringing people in, we stand to benefit from some of these things. We stand to also have access to some of the CME courses run by both Quorum and other affiliated institutions. So yes, I'm sure it's going to be a win-win on both sides.
So the college has already set up the Ghana National Ambulance Service as a ACLS training provider through the American Safety and Health. And this is where I first met you, Emmanuel. It's
Yes.
2 years ago now, three years ago now.
3 years ago.
I was kindly invited into Ghana by Professor Zachariah, who runs the GNAS, the National Ambulance Service, and they have now been running BLS and ACLS courses for the ambulance paramedics. And Emmanuel, you've had the idea of having that same setup here, where you can start putting all of the hospital faculty and staff through BLS and ACLS.
Yeah.
And how many staff is that going to be?
Nurses alone in the hospital, we have about roughly 1,500 nurses. The entire population of Komfo is running somewhere between 4,000 plus or minus.
So 4,000 people within.
So imagine having that number. Yeah. And this is both clinical staff and allied health.
Yes.
And support.
And even the janitors need BLS.
Certainly.
Everyone needs BLS. Yeah.
So the A&E alone, we have close to 200 nurses or more.
200 nurses just in the A&E department. So we're 12 people per course. You're going to be busy.
Yeah.
Yeah. So the first order of business is getting the two of you who are ACLS instructors to set up this new training center, and then you choose who your instructors are, and you teach them up, train them up, and then have them run courses. So how many ACLS courses do you think you're going to be able to run in 2025?
Like you said, we're going to be busy, and so we need to structure it well that if not every month, we can actually do every other month, because there's going to be a demand, and once there's a demand, we should be able to meet supply. Yes.
So we're happy to do that, and we've done this with many different other organizations in Africa. But what else? What's a 5-year plan? So we're putting this together, and I'll hear from both of you. But John, what do you think the 5-year plan is for this collaboration between Quorum and CAF?
I think the setting up the center, as you say, is kind of the first step, and we start to integrate then our students that are coming here and how can they support that whole process. And then likewise on the preceptor side from CAF of how can they best support and make the learning environment one that is valuable, that the student walks away with an experience that they'll, we'll talk about and network with for years to come. I think that is, building those relationships. It's all about those relationships. And so we know that when we have students that come here, and just like you said, when you met Emmanuel 3 years ago, it was because you were here for something else. And now that has developed into this relationship with him sitting on the Board of Regents and being an active student, and then facilitating this meeting with us here with his administrators. So those kind of relationships, I think it's really cool to have the students that come here and walk away and have friendships and people that they know they can call and count on later and say, hey, what about this idea? So I think that's a really interesting building block that we're going to start. But in the next 5 years, I would expect to see that we would get a constant influx of students here. Ideally, rather than being, a couple of weeks here or a couple of weeks there, is that we have a pipeline of students that, have essentially a year. Quorum would have a year-round presence here in Kumasi, with students coming and going and almost doing a handoff to each other as they leave their clinical rotations. And then on the doctoral side, I think the research opportunities are rich. And so it'd be nice to have our doctoral students looking at that and co-publishing some, cutting edge research that shows what's going on here and how it impacts healthcare around the globe.
Emmanuel, what would you like to see in the next 5 years?
I think that in the next 5 years, we're looking forward to a more sustainable relationship that endures to the benefit of both organizations. That's what we're looking at.
All right. So it's great to be back to Ghana, and we'll see how things go from here. But I guess my final question for you is this. What advice do you have for the new nurse, the new doc, the new paramedic just starting out on their career in austere medicine?
Be ready to ask questions and don't think you know. It saves life.
John?
The greater good. It's when you save a life. I think he's got it captured right there. That's the advice. Is you're here to do good.
So Emmanuel, it's great to have you on the podcast. I appreciate what you're doing, John. It's the third time now back on the podcast. I imagine you'll be on again shortly. But Emmanuel, I appreciate what you do here and the beacon of light that you're making. You said Center of Excellence.
Yes.
And that's precisely what it is. So thank you for making this place better.
Thank you.
Thank you very much.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.